So today we're going to talk about the ethics of burnout and impairment. This was originally written for counselors and social workers. So there's one or two pieces kind of in the middle that are specific to them, but is going to apply ultimately to other mental health and medical areas as well. So also, if you were here last week, I promise this is a little bit lighter uh, topic. We're going to have some fun today thinking about burnout and impairment. So for those who don't know me, I've been in LPCCS here in Ohio for over 15 years. In December, I released my dissertation on how counseling supervisors experience client suicide. Most of my research is around suicide. I've also worked in community behavioral health on the crisis side of things and also in college counseling, and currently work, as I mentioned, as the director of the Criminal Justice Coordinating Center of Excellence, as well as with a nonprofit in Stark County, Ohio called Light After Loss. But we're going to jump right in because I want to make sure to get through the slides this time. I don't want to skip over anything. So something that's always interesting for me, if you want to drop in the chat, why did you want to come to this particular topic today, right? Because it's just always interesting to find out kind of what, spurred folks. Was it the ethics piece? Was it the burnout and impairment piece? So as you're listening and feel comfortable, please feel free to share in the chat. So really the first thing I always like to touch on is, why should we be combining the discussion of ethics with the discussion of burnout and impairment, right? So really for all of us, since we're all either in the mental health or the medical profession, there does become a line where this is an ethical issue. There are differences between burnout and impairment. We'll talk a little bit about that, how burnout could, potentially lead to impairment, and the fact that impairment is where we start having ethical issues related to client and patient care, and really thinking about when you may need to step away or a supervisor may need to intervene when impairment's actually going on. So we're going to talk a little about how these kind of all interplay together, but also give some suggestions for supervisors, for ourselves, and also for leadership when thinking about burnout and impairment. So to start with, I just want to put out there some definitions. So burnout, and the definitions on both burnout and impairment vary, right? Depending on what source you're looking at. Are you looking at medical and mental health information? Are you looking at kind of more business and career focused things? They all kind of have these different definitions, but the main themes are burnout is really primarily related to being work related or work caused. It can come from prolonged exposure to stressors, again, specifically within work. Some of the common attributes are exhaustion, detachment, negativity or cynicism, again, specifically towards work. So again, a lot of times with burnout, we start getting this more narrowed focus on the work environment or just what you're doing for your job. It can start to really creep into kind of all your thoughts and feelings about work. But, it can also have impact on memory, your focus, ability to multitask, communication skills, some of the things we all need quite a bit for the work, right, that we do. The other piece is that with burnout, we tend to know that it's happening, right? And we also tend to talk about that it's happening. Burnout is one of those weird things where over the last several years, it has almost become a bit normalized to kind of be burned out and embrace being burned out and talk about being burned out. And like, there were literally pages and pages of pages when I did a single Google search for burnout that came up, because it's talked about a lot more, but not necessarily in a let's fix it and address it. It seems to be more about, yep, that's me too, and I'm burned out and proud. It's a very interesting thing to be watching. It can be, burnout itself can be periodic, but you can also have periods of respite. Like I have said to my direct supervisor in our meetings before, that I was like, I'm not burned out, but I'm having moments of burnout. Like, I'm not having this every day. It's not a whole day experience, but like I'm having a moment with it, like this week or with this particular thing. It can be kind of a hidden internal experience. But then there's also things I think specific to our fields, right? We see there's kind of this push pull between when you're supporting other people, How are you checking on yourself? Do we kind of neglect that with ourselves because we're supposed to be the helpers, right? So there's maybe even some stigma that goes along with this to also be aware of. But what is it really? And this is how this was what I came up with from burnout is your work is getting done. Stuff is coming in by deadlines, it's happening, and you feel awful while working. And others may or may not be aware that you're struggling, and it might be getting normalized by some of those conversations, or you might even be normalizing it for yourself of, well, it's normal to feel burned out when it's this time of year, or it's normal to feel burned out when we're doing strategic planning or when we're doing budgets for the year, right? So there can be some of that normalization that can happen with burnout. But now when we're looking at impairment, it gets a little different, right? So again, there are a lot of different definitions, but the main themes is that now your professional abilities and competencies are getting compromised. There's negative impacts on the delivery of services and treatment. This can compromise and potentially pose risk to clients, right, in your care. Any condition, physical, emotional, behavioral, or a combination of these can be part of impairment. It could be a physical impairment, an emotional impairment, cognitive, behavioral, or all of it all together. It could be the result of long-term, more unmanaged burnout, but it could also be due to just sudden, overwhelming circumstances that can more immediately cause this. The other piece is that this tends to be a little bit more hidden, or we think that it's hidden. That's where the picture comes from, right? We all have the cat who thinks they're so clever at hiding, but they're really not. That's kind of what impairment is. Like, we might be trying to hide it, but like other people are picking up that something's going on. And because of our work, we may actually struggle to see or might even ignore signs of impairment. That could be a struggle to kind of recognize it in yourself. That could be, that perception of us as fixers. We're not the ones with the problems. We help everybody with problems. Sometimes there can be a tendency of kind of pouring problem solving into others instead of ourselves. There can be a lack of comfort with self-assessment and reflection. This can come up in supervision a lot. If you have, some younger clinicians that you're working with and just don't have those skills yet, they don't have that practice. But there's also a lot of lack of consistent assistance with how to do that. And how do you evaluate yourself and how do you reflect on yourself in regards to burnout and impairment? With impairment, there's also very real fears of punitive measures, right? If you're caught being impaired, that's what everyone's worried about. And no one wants to be impaired. We're basically okay with being burned out, but we definitely don't want to be impaired. The way I try to separate these is burnout is the feelings, impairment is now behaviors. Now is where we're having potentially problematic behaviors. So what is that line? Remember, it really is that with impairment, it's getting into your ability or anyone's ability to provide care, right? It could hinder growth, it could hinder recovery times, it could hinder the therapeutic relationship. And when we talk about what that looks like for us, I just gave some very concrete examples. Like it could be documentation going unfinished for months at a time. It could be complete lack of engagement with clients. It could be blocking your calendar so no one can put clients on your calendar. It can also be ending sessions early or repeatedly canceling sessions. But it can also be inappropriate self-disclosure in sessions, right? Because again, there's maybe some boundary impairment. There could be some social impairments that are going on with this. So with impairment, your work now isn't getting done. It's not. People aren't getting the care that they need. You're not completing tasks, right? You're not getting those day-to-day things done. And you do still feel awful while working. So that is still happening. And again, like we talked about with the cat who thinks they're hiding, the reality is that with impairment, it is very often true that others are aware that you're struggling and you're trying to hide it, right? Because no one wants to be impaired. There could be punitive measures, right? There's all these layers that can come with impairment or burnout. So now we get to the fun part, right? The ethics and law of this. I'm not going to go into kind of super detail. I'm going to highlight a few things just to be aware of, at least from kind of the mental health counselor perspective. But like I said, there's going to be similar things that parallel this in, the other professions that are represented here. So one of the things that I always like to say is Ohio is very good about this. So with counselors, we have the American Counseling Association Code of Ethics. And then it got together with the Ohio Revised Code and had a baby. And that baby are our laws and rules. So in Ohio, a lot of our ethical considerations that got codified over with the ACA is actually in our Ohio Revised Code. So the national ethical codes are often cited in complaints, can be cited in litigation, but it is the laws and rules and the things that are actually in the Ohio Revised Code that are used as part of discipline by our licensure board. And that discipline does include when a clinician is impaired and can include loss of license. So in Ohio, we're one of the states that took it upon ourselves to not just recognize, right, that there's ethical codes and you should all be performing and doing your work ethically in the medical and mental health community, but we also went and put it in our law. This is true for social workers, marriage and family therapists. There's, parallels with this with dentistry, with, veterinary care, right? So that's something that Ohio is kind of known for. So if you're not in the counseling field, this is something to be aware of and kind of look into. So this is just a couple examples. So in the ACA Code of Ethics, we have that we're supposed to be, of course, avoiding harming our clients and our trainees and research participants. We are supposed to be monitoring ourselves for impairment. These are ethical expectations. But then in the Ohio Revised Code, we have the standards of ethical practice and professional conduct, impaired practice. And this is the actual code that talks about if, in this example, a counselor is impaired, these are all the things that you are not to be doing if you are recognized as being impaired or if you are found to be impaired. So there's this expectation that we're supposed to monitor ourselves, but then in Ohio, there are other things that you are expected to do should this be, identified with you. And it can go all the way to, having to, close down, relationships with clients. It may have to do with getting additional supervision. There's a lot of other things that can happen if this comes through with our license board. Again, we also have reporting ethical concerns. And so this has to do with also knowing that there is an expectation in law that we are, in a way, mandated reporting. If you have a license and you become aware of someone also with a license who you believe is impaired, there is an expectation that that is reported. Now, it's not necessarily 100% clear who you have to report it to. It doesn't necessarily say you have to turn it into the board, but there is this legal expectation that if you identify either yourself or someone else is impaired, that this is being reported so that it can be addressed. We also have impaired practitioner rules, and this has to do with, the process and possible requirements or sanctions. Again, this is specific to counselors, but this has to do with kind of the process of, if someone is, for lack of a better term, accused of being impaired, there is an investigative process with this. There's an evaluation process related to this, in order for the board to determine, kind of yes, no, there is an impairment. Was it an impairment that directly impacted client care? Like, has there been a violation here? Sometimes it's getting caught before it starts affecting clients, and sometimes not. So this is just to know that there is this process out there if there is this concern, whether it's about you or others. So the other thing that comes up is, well, then what's the expectation here, right? Like, what does this mean? And, one thing that I have seen a lot is this thinking that, only you can prevent your own burnout. And, I'll be honest, I don't know that that's true. So I wanted to pull together some suggestions for individuals to think about, but I'm also going to touch on things that leaders should be looking at doing, as well as, direct supervisors. So for us as the actual clinicians, and I realize it says mental health, but I think this is true of all clinicians and caregivers, is first off, yes, it is our responsibility to engage in that self-monitoring, right? To engage in that self-reflection. about our stress, our burnout, potential impairment, and to take it seriously for ourselves. It's not a joke. I mean, I know I put that meme up there earlier with everything's on fire and the little dog is like, hey, everything's fine. But we really do need to take it seriously, right? We use humor to diffuse it a lot, which is, it's a coping mechanism that most of society has kind of given the thumbs up to. But we need to take it seriously for ourselves. So it is also checking in with others, trying to be resistant to this kind of normalizing piece, right? Where others are telling you it's normal to be burned out or it's normal to feel this way during, this particular time of year. Or, if I think of teachers, well, it's always the worst in August. Well, then it's always the worst in September. And then it's the worst in October. And it just keeps, kind of going. It is, though, an expectation. We should be responsible for sharing, with our supervisor how we're doing, sharing if, how we're feeling about work. Has it taken a sudden turn? And this is one where I encourage folks to, sometimes it can be really hard to separate the person from a process, but a lot of times there may be something at our work that is stressing us out that sometimes we assign to a person that may actually be a policy and a procedure. Those are things that are good to share with leadership and with your supervisor, because those things could be changed. They could be looked at, they could be altered, they could be revised, right? They could be updated. I think it's also our responsibility that when you do realize that something like this is happening, that we are getting help, whether you're looking at your EAP, your employment assistance program, or sometimes even taking FMLA. I will often tell the story of my spouse, who was a master's level social worker for over 20 years. In the last few years since COVID, he's needed to take FMLA multiple times because of burnout and not concerns about impairment, but obviously concerned that if he continued to be burned out, he was going to have impairment problems. And ultimately, he did end up leaving our field last year because of just, the stress level and things like that. And then the other thing I always try to push with ourselves is you got to take that vacation. You got to take those days off. You got to use your PTO and do it in a way that feels comfortable for you. I don't always feel comfortable taking a whole week off. It doesn't jive with me very well, but taking like 2 or 3 Fridays off in a row or 2 or 3 Mondays off in a row, like that's how I can get a longer weekend. That can help me, get rejuvenated, and I can still be doing that. So again, it's doing it in the way that works for you. It's also knowing what you need to do for your self-care. This is something that I have done with a lot of supervisees and clients over the years, is making, collages of what are your things for self-care? Who are those people? What are those activities? The picture up in the corner with the dinosaur is we did a campaign at one of the last places that I worked at, where we were giving out sheets of bubble wrap to everybody. And on the sheet, that sticker gives some suggestions for managing stress and has some links to resources. So, and then my friend put on his dinosaur costume and we got to walk around and give them out to everybody. So, just again, things that are going to work for you, not going to be the thing that works for everybody. I am also happy to be transparent and say that I do see somebody to talk about this. I do see a therapist. I'm also working on being better about taking my PTO. I am not there yet, but it is something that we work on. Responsibilities as a supervisor, right? You can't talk about what we have to do without also talking about what our supervisors and leadership should be doing, is the idea of be checking on your folks, right? We already talked about earlier that they may not have insight into their struggles. They may not pick up on them. You may be picking up on them instead. Or if no one's asking about these things in particular, not a lot of people are going to bring it up until they're to the point where it's really bad. So making sure that you're asking these questions, make sure that you are in a very non-judgmental way providing resources. And I feel the need to say that because I have heard of many instances where I was told about FMLA, but it felt like I was not allowed, I shouldn't do that. Or I was told about the EAP, but I found out it actually wasn't covered by my insurance, right? So you want to try to offer these things in a very non-judgmental way because your people have rights to them. So you want to be mindful of that. Be willing to listen about complaints, be willing to hear about policies, procedures, and processes. and be open to advocating for change when it's appropriate and warranted, right? Be willing to do those things. Even if it doesn't produce a change, seeing a supervisor do that, seeing somebody step up for them is a big thing for really any employee. And when someone needs to address burnout and impairment, do it in the also, it's also important when we address this is also to address what might happen if there is an improvement. So that's the other ethical piece with this is when you become aware of a concern, you do need to address it directly, right? You need to ask about it. It's not fair for you to wait on them to bring it up to you. It's actually not ethical. If you become aware of this concern, it's being clear about what's going on currently, providing support, helping them to, gain some improvement with burnout. It can be a little bit less intense, right? We're providing resources, maybe talk about some temporary things, maybe, get them out of the office a little bit. When there's a concern that someone is impaired, this has to be very clear and very direct, right? So it needs to talk about expectations. It needs to talk about what the plan is, what they need to do, right? Behavior and task wise, but connecting them again still with those appropriate resources. Also, you do have to assess, is there harm happening? Because that's that line, right? If there's, because you can catch this before there's actual harm happening to anybody else other than the person. If there's harm happening to others, this obviously has to ratchet up and you may have to take it further. But the other thing you want to be very mindful of when doing this is to keep in mind that sometimes impairment, like we mentioned before, can come from other circumstances. It can come from a change in medical status. It can come from a change in mental health status. Those are protected parties. So you do want to address this, but also be mindful that you are not also violating any, disability rights laws or, they're violating any disability laws or violating their rights. So this doesn't mean that you don't address it. This again means that you still address it directly, keep it work oriented, right? Help them make a plan, help them connect with those resources appropriately, and just be very clear, right? But that is something that when things are about impairment, you do want to keep in mind is depending on kind of where the root cause of that may be coming from, there may be other things at play. Other resources for them, but also other protections that may be at play that you'll have to navigate, and you can navigate them. So what about the other people, right? The leaders, the higher ups, right? There's some responsibilities there. So it is important for leaders to really be thinking about having, supportive policies that account for the different roles and stressors that those roles have. It is a different set of stress that your crisis workers have versus your front desk. One is not better or worse, but they are different, right? There's different stresses that your interns are under versus your CFO, right? It's just understanding that those stressors can vary by role. Being open again to looking at policies and procedures regularly and with input from all those different roles. Because one policy that maybe works great for the financial department is putting a huge burden on payroll. Or maybe it's the other way around. Something that works really great for payroll is putting burden on staff. Or something that's working for the records department is putting a burden on your therapists, right? So there can be a lot of back and forth, and there has to be that willingness to bring everybody to the table to really see how things like this, actually play out. Keeping those support resources accessible, and again, making sure to just consistently reinforce that availability of those resources, in particular EAP and FMLA. Really what this comes down to is none of us want to be impaired. None of us want to see somebody become impaired because of work or other reasons. And really it's safety and the best possible care and service to our clients is what we all agree on is what we want to be providing. So that is today's presentation. It was